rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Today, I saw a patient with breast cancer who had just completed neoadjuvant chemotherapy and surgery. Her tumor had responded to treatment, but she wanted to know, "Doctor, what does my prognosis look like now?" Rather than looking at the post-treatment pathology alone, let's take a closer look. Our patient is a 48-year-old woman with non-metastatic breast cancer. Before neoadjuvant chemotherapy, her clinical stage was Stage IIIA. After chemotherapy and surgery, her final pathologic stage was P Stage IIB. Her diagnostic biopsy showed ER-negative, grade 3 disease. Let's assess her prognosis using the CPS+EG Score Calculator in the OncoToolkit. The CPS+EG score combines information from before and after neoadjuvant treatment with key tumor characteristics. Let's enter our patient's information. First, her pre-treatment clinical stage was Stage IIIA. So we'll select Stage IIIA. Next is the post-treatment pathologic stage. After neoadjuvant chemotherapy and surgery, she was classified as YP Stage IIB, so we'll select Stage IIB. Next, we'll enter the estrogen receptor status. Her tumor was ER-negative, so we'll select ER-negative. Finally, her nuclear grade was grade 3, so we'll select grade 3. Now, click Calculate Score. Here are the results. The patient's final CPS+EG score is 4. According to the historical cohort data shown in the calculator, a score of 4 was associated with a 5-year distant metastasis, free survival of 63%, and a 5-year disease-specific survival of 72%. These figures provide useful prognostic context, but they represent historical cohort outcomes rather than an individualized prediction for this patient. To see how the result was calculated, expand how this result was calculated. The calculation is straightforward. Clinical Stage IIIA contributes 1 point. YP Stage IIB contributes 1 point. ER-negative disease adds 1 point. And grade 3 adds another 1 point. That gives a total CPS+EG score of 4. You can click Copy Result to copy the assessment. To save it, enter the patient's name and click Save. Previously saved assessments can be viewed from the Saved Results panel on the right-hand side. The Clinical Workflow section also provides additional guidance on when and how to use the calculator. One important point to remember is that the original CPS+EG data predates several modern breast cancer therapies, so the score should always be interpreted alongside current clinical practice and the patient's overall clinical picture. If you'd like to learn more, scroll down to the reference data below. Here you can compare the historical outcomes associated with different CPS+EG scores. For this patient, the final CPS+EG score is 4. By combining pre-treatment stage, post-treatment stage, ER status, and nuclear grade, the CPS+EG score provides additional prognostic context after neoadjuvant chemotherapy and surgery. For more oncology calculators and clinical decision support tools, explore the OncoToolkit.